Happening now, some advice to keep in mind the day before Thanksgiving as we ease into the holiday. It's, of course, traditionally a time for family and friends and a lot of food, but sometimes in the hustle and bustle, there's room for error. And we want to look at how you can make sure you stay out of the hospital over the holidays. Joining us now, Dr. Patti. He's Senior Attending Physician of Emergency Medicine at St. Barnabas Hospital in the Bronx. So the right person to talk to about this. Okay, a couple really general questions, because we know in Thanksgiving there's a tendency not to just eat quickly and leave the table, but to sort of graze. So how long can you leave the food out before you should maybe reconsider? Usually
the time that's quoted is usually no more than 2 hours, before you should really start refrigerating the leftovers. You also want to keep the raw foods and the fresh foods away from some of the prepared items. You don't want to be mixing them all in the same serving platters and dishes.
So have a little strategy.
You definitely have to have a strategy. You have to be careful with your meats and your vegetables, how you prepare them. You need a lot of hand washing. You need a lot of warm soapy water on those cutting boards and surfaces, and keep the pets out of the kitchen as well and away from the food.
That's a good one. The pets.
Really?
Not just the kids, but the pets too.
And not just the older gentlemen who we also look at as pets, but keep every animal out of the kitchen.
Now, one of the best parts about Thanksgiving is the leftovers.
Definitely.
We all know that. Is it safe when you're reheating the food just to zap it quickly in the microwave, or are you setting yourself up for not reheating it properly and getting sick?
It's okay to use microwave, but you want to really reheat the food. You don't want to eat cold leftovers, because you want to get them over 160 degrees usually to really effectively kill bacteria. You also want to pay attention to anything that's made with creams or mayonnaise or sauces like that, because they tend to harbor bacteria as well.
All that good stuff.
All the
Some
great
of my favorite stuff has that ingredients. A question about burns. It's easy to get really busy in the kitchen. You're grabbing a lot of plates. You get a bad burn. There's, some old wives' advice about putting butter on the burn.
No.
That's a no-no.
That's a no-no, because what you're doing basically is you're cooking your skin. You have to effectively reduce the temperature of your skin. The easiest way to do that is keep it under running cold water. Don't put ice cubes directly on it, because they could actually make the burn worse in some cases. Cold water, under the faucet, under a pitcher of water, in a pitcher of ice water, until it's so cold that you're like, oh, I can't take this anymore, usually 15 minutes. You lower that skin temperature sufficiently that you prevent blistering, and you'll prevent the sequela of a bad burn.
Some good advice for us. One of the other things you encounter on Thanksgiving is some indigestion.
Always.
We've done a lot of segments, though, about heart disease, heart attacks, early signs of heart attacks, and sometimes that shows up in feeling like you have really bad indigestion. So is there a way to know, this is indigestion that I need to, have some Tums and get on with it, or this is indigestion that is actually the sign of something else because I'm busy, I'm stressed, I'm running around?
Well, it's still one of the most difficult diagnoses to make, whether it's heart disease or common indigestion. But usually if it's people who have comorbidities or other health issues, heart disease, pre-existing pulmonary disease, diabetes, things like that, and they have a heavy meal and they start getting indigestion that's really not relieved with the antacids or the Tums, and they keep coming back repeatedly saying to you, could I have another one of those heartburn medications? Those are the folks you should really get them evaluated. The problem is it's still tough to tease it out.
So it's not just a single symptom that shows us. Really quick, I have to ask you kind of a lighthearted question. One of our senior producers, our only senior producer, was eating this for breakfast. Can we show them what Clint had for breakfast? Doctor, in your professional opinion, does this have all the nutritional benefits that one needs during the holidays? The pumpkin pie and quite a bit of whipped cream, I would say.
It's definitely not the breakfast of champions, I have to tell you that. But I am fond of my pumpkin pie with fresh whipped cream, and I'll be making that this holiday.
And I mean, once or twice a year in the morning, right? It's an okay breakfast, right, Doc?
Everything in moderation, common sense, like we said. Get your flu shot, prepare for the holidays.
As well.
Right?
All right, so I guess Clint gets away with the pumpkin pie, at least
we'll
for
give
today.
We'll
give him a pass, right, Doc? Okay.
Exactly.
Dr. Patti, great to see you.
Thanks so much for having me.
Thank you. John, did you get a piece of that pie? Because I did not.
I did not. I would go with apple pie for breakfast.